Welcome to the American Cancer Society's Research and Training webinar. Research and training is at the core of the American Cancer Society's mission, finding cures and providing the insights that inform our education, service, and advocacy efforts. We hope that our children, grandchildren, and future generations will experience cancer differently than we do today, if at all. Research provides that source of hope. As we think about American Cancer Society research and training, it's important to stop and appreciate the power of one individual's passion. Like you, Mary Lasker was an American Cancer Society volunteer, a socialite and philanthropist, and a strong advocate of the importance of biomedical research. Everything discussed in this training session was created through the efforts of her and her colleagues to raise more than $4 million for the American Cancer Society, with the promise that 25% be used to establish a research program. Mary Lasker's belief in the power of research to change lives helped begin the Society's research department in 1946, and it's the passion and commitment of volunteers like you who are taking that foundation and continue to build the unique and far-reaching program that will save countless lives into the future. So the task of cancer research is very straightforward: to find out what causes cancer. How can we prevent cancer? How can we detect it in its earlier, more treatable stages? How do we treat people with cancer most effectively? And how do we best support patients and their caregivers during and after their diagnosis to enable them to experience a high quality of life? To find the answers to these critical questions, the American Cancer Society has built a rich and comprehensive research program that attempts to leave no stone unturned in its search for these answers. We study cancer across the cancer continuum. We study cancer in cells. We look at cancer in model systems. We seek to understand cancer in patients, and we explore how cancer is experienced in populations. The American Cancer Society's comprehensive research program includes an extramural grants program to fund innovative, high-impact research at external institutions and training for scientists and healthcare professionals, as well as an intramural research program to conduct, collaborate on, and publish high-impact research by our own world-class society researchers. These American Cancer Society intramural researchers ask the questions that help provide the evidence that allows us to be successful with the rest of our mission: screening guidelines, tobacco, physical activity, and sun exposure recommendations, health and insurance policy standards and positions through our advocacy affiliate, the American Cancer Society Cancer Action Network. Several times a week, whether you're watching TV or reading an online newspaper article, you inevitably come across a story on cancer. Almost always, these stories say, "According to the American Cancer Society," and what follows as data that comes from society research. The Facts and Figures series is the respected source of information on incidence and mortality rates. Analyzing these trends in different organ sites and for different populations provides critical information on the status of our fight against cancer and the effects of different interventions. The Behavioral Research Center focuses on quality of life and survivorship, disparities in cancer risk behaviors and outcomes, and behavioral interventions for smoking cessation. It also helps to advance research in the field by collaborating with the CDC, NCI, and Livestrong to convene the Biennial Cancer Survivorship Research Conference, which brings together researchers, clinicians, cancer survivors, advocates, policymakers, and public health experts to share the latest research and interventions designed to improve the long-term health and quality of life for cancer survivors and their families. For over 60 years, the American Cancer Society's epidemiology research team has conducted some of the world's largest cohort studies to identify the causes of cancer and ways to prevent it. Findings from ACS research have provided the scientific evidence base to create cancer prevention and control programs, policies, and guidelines. The American Cancer Society's epidemiology research team was the first to demonstrate the link between cigarette smoking and lung cancer, the first to show a link between regular aspirin use and lower risk of colorectal cancer, and the first to provide evidence that obesity increases the risk of premature death. The American Cancer Society is uniquely positioned to take advantage of such notable research accomplishments. Society research forms the evidence base for local, state-level, and nationwide programs and advocacy efforts that are dedicated to saving lives. But it's not just through our in-house researchers that we seek to answer the questions of how we can prevent, detect, and treat cancer, and we can improve quality of life for patients and caregivers. The American Cancer Society's second approach to finding answers is by funding the most innovative research projects with questions asked by a research community led by the best and brightest young minds at our nation's top institutions. The Society evaluates these novel ideas and questions through grant applications twice a year, at which time they are reviewed, discussed, and ranked by their scientific peers, who are thought leaders in their fields. Included among these grant applications are proposals from the next generation of health professionals. The Society is dedicated to growing the field of oncology nursing and social work and to training primary care physicians in cancer control. Only the very top-tier projects, those with original and inventive approaches to answering our critical questions about cancer, are recommended for funding. It's this strategy that has allowed the American Cancer Society to claim 47 Nobel laureates and 80% of the heads of the NCI-designated comprehensive cancer centers as our own, as well as to have played a role in almost every advancement from cancer research in the past 70 years, from the early promotion of the value of the Pap test to the development of groundbreaking therapeutics such as Gleevec. The Society's belief in focusing on innovative science as the way to most quickly and fully get answers to our questions about cancer means that we fund the best science, period. The reason for this lies at the heart of research itself, as the ultimate application of a finding may be different than the original intent of the research. For example, crizotinib, approved by the FDA for the treatment of non-small cell lung cancer in 2011, targets a gene mutation that former grantee Dr. Stephen Morris first found in lymphoma over a decade before. Another example of the unexpected applications of cancer research is the breast cancer drug Herceptin, which had its research origins in cancer-causing genes for neuroblastoma and glioma that were discovered by American Cancer Society research professor Robert Weinberg. Because of this approach, the American Cancer Society can truly claim that its focus is every cancer in every community. Innovative, outside-the-box ideas so often come from young minds. Because of this, the majority of the Society's research grants are awarded to early career investigators, scientists who have just finished their terminal degrees, such as a PhD, or who have recently been awarded a faculty position at a major institution. Additionally, by providing scholarships to cancer nurses and social workers, and by supporting primary care physicians seeking training in cancer control, the Society is training the next generation of cancer health professionals. By bringing the best and brightest to the research pipeline, armed with novel, and through ACS funding, proven ideas, the American Cancer Society leverages its small investment into a lifetime of inquiry and answers, which will change the cancer experience for our children and grandchildren. Here's a group of about 50 of our postdoctoral fellows with Dr. Otis Brawley at a 2011 scientific meeting in Boston. Among them, a biomedical engineer whose lab developed a device that measures cancer cells in the blood. They're currently in talks with a major pharmaceutical company about next steps. Also here is a cell biologist who discovered and named 2 novel genes during the course of her grant project, and a urology fellow who was interviewed on CBS Evening News about his research on bladder cancer screening guideline compliance by physicians. These are just a few of the questions answered and careers begun through your Relay for Life efforts. At a time when federal funding for research has significantly declined, the mission of American Cancer Society research becomes all the more important. Dr. Boger's 2008 quote here tells us what's at stake. As you have heard in the past few minutes, American Cancer Society research has helped answer many of the central questions about the causes of cancer, and these answers have contributed to the countless number of lives saved. Perhaps you've even been the beneficiary of how we put our research into action. Due to the complexity of cancer, we've not yet been able to prevent or successfully treat all cancers. We know that most lung cancers can be prevented, but we don't yet know how to prevent pancreatic cancer. Through mammograms, we can detect breast cancers at their earliest stages, but we're still working on detecting early-stage ovarian cancer. We successfully treat and even cure leukemias in over 90% of children, but with our current knowledge, only 70% of adults. There are over 14 million cancer survivors in the United States, but we're still learning how to ensure that all survivors have access to the best resources to improve their quality of life. Tremendous progress has been made, but there's still work to do. Today, lack of funding means that the American Cancer Society cannot meet its own goal of asking all the questions our scientific volunteers have judged important. Unasked questions are not answered, and thus cannot be put into action to save lives. The American Cancer Society research and training programs are dedicated to transforming cancer from deadly to treatable, and from treatable to preventable. For over 65 years, the American Cancer Society has been finding answers that save lives. And with your help, we'll finish the fight.